Hello. So today I want to talk about the issues with placenta location during pregnancy. Most of the times people keep asking about what is low-lying placenta, what is anterior placenta. So I'm going to really elaborate on these kinds of location of placenta. So when you go to the facility and then they give you some of these names or diagnosis, then you really understand. Okay, so placenta is an organ which is formed during pregnancy. So it means that if you are not pregnant, you don't have placenta in your system. Once it develops around the 12th week of pregnancy or from 3 months, it starts working actively. So it produces hormones to control, to help maintain the pregnancy. It also serves as a barrier through which the mother serves the baby with oxygen and then nutrients from her bloodstream, and then the baby also brings out the waste product from his system through the placenta, and then there's this vice versa exchange of gases and other things. Now what happens is that when you are pregnant, some factors may make it appear that your placenta should actually be located in the front part of your uterus or lower part or above. Let's take my hand to be the inside of your uterus. Okay, when I say uterus, I mean your womb. So usually, or the normal one is when the placenta is attaching to the top. So this is the top of the uterus. Okay, so any part of the top when the placenta is implanted there, it is normal. Now, when you come to the front, so I said this is the uterus, okay? So this side of it is the anterior. Anterior means in front. So that is the side of that faces the front part of the mother. So if any part here, I mean the front, if the placenta is attached to any part of that area, we say anterior placenta. So it can be up anterior or low anterior, but once it is anterior, it means the placenta is in front. And mostly people with anterior placenta, because it is occupying part of the anterior aspect, when the baby is kicking, you don't really feel it that much, okay? And it is not a bad sign. Now when we say low-lying placenta, this is top, this is down. So the down means the cervix is around here. That is the entrance to the uterus. So if the placenta is attached to the down part of the uterus, okay, we say low-lying, and that could also be called placenta previa. And we have degrees. We can have type 1 and type 2, 3, and 4. The type 1, it is not really covering it is at the edge, okay, at the side of the lower side, and so it doesn't